For this month's video chat, I want to focus on Academy advocacy efforts. Back in May, I shared the results of the Academy's membership survey. When asked what challenges you would like us to address in the future, the top concerns amongst practicing allergists were reimbursement, compensation, and insurance issues. Based on your feedback, we have worked to improve our advocacy efforts and to better communicate these activities to all of you. Our Advocacy Committee is chaired by Paul Williams. Stuart Abramson serves as vice chair. Key committee members include representatives from the RSL Assembly, Office of Practice Management, the Division Directors Committee, and most recently, the Committee on the Underserved. Having representation from these constituency groups enables us to prioritize our advocacy efforts to address the most relevant issues and concerns of all allergists, regardless of practice setting. Given the impact of poverty and race on health disparities in our specialty, as well as the overrepresentation of racial and ethnic minority groups among hospitalized patients with COVID-19, we added representation from the Committee on the Underserved to the Advocacy Committee earlier this year. We also look forward to the publication of a work group report from the Committee on the Underserved entitled Health Disparities in Allergic and Immunologic Conditions in the Underserved. So what are some of our advocacy priorities? Physician reimbursement, telemedicine, protecting in-office compounding of allergen extracts, increased research funding for food allergy, promoting penicillin allergy testing as a tool to combat antimicrobial resistance. Now, these are just a few of the areas in which the Academy is consistently fighting for our members. Let me highlight a few recent examples of our success in advocating for the practicing allergist. First, the School-Based Allergies and Asthma Management Program Act, H.R. 2468, a bill supported by the Academy that is based on our School-Based Asthma Management Program. You know that as SAMPRO. This bill passed the House of Representatives just last week with a unanimous voice vote. This bill encourages schools receiving asthma-related grants to have trained personnel and a comprehensive school-based allergies and asthma management program. Now, did you know that H.R. 2468 was actually initiated by the Academy, with sponsors Majority Leader Steny Hoyer and Representative Dr. Phil Rowe, and joined by more than 40 bipartisan co-sponsors? The Academy continues to lead advocacy for congressional adoption of this bill, and we will be meeting with the bill sponsors' staff to work on strategy to pass the School-Based Allergies and Asthma Management Program Act in the Senate before the end of the year. The Academy also continues its leading role in advocacy for penicillin allergy testing as a public health measure to combat antimicrobial resistance. We have presented on the importance of this issue to the Presidential Advisory Council on Combating Antibiotic-Resistant Bacteria, and we are an active member of the Stakeholder Forum on Antimicrobial Resistance. This is a coalition of more than 100 groups working to connect governmental and non-governmental activities in the fight against antimicrobial resistance. On September 28th, National Penicillin Allergy Day, we sent a letter to 715 members of congressional staff to share important information on the issue, as well as our recent letter to the Centers for Medicare and Medicaid Services, CMS, where we joined with the Infectious Diseases Society of America to urge that Medicare conditions of participation include penicillin allergy verification as part of antibiotic stewardship. the Academy continues to advocate for your practice as the USP Pharmacopoeia works through appeals regarding beyond use dates, BUDs, for certain products and procedures covered by USP 797, which, as you know, includes pharmaceutical compounding of sterile preparations. In a September 15th meeting of the USP Compounding Committee, compounding pharmacists challenged why beyond use dates, BUDs, for allergen immunotherapy are treated differently in the proposed updated Chapter 797. In response, a committee member addressed extending use dates for allergen extract mixed in office and acknowledged the Academy's leading role in reaching safety procedures for in-office compounding of allergen immunotherapy. So when it comes to our advocacy efforts, collaboration with other organizations and stakeholders is a key part of our strategy. It is when we stand together that we can affect meaningful change. Now, there's just one more element in our advocacy efforts that I want to mention today: the tremendous work we have been doing in the realm of payer relations since 2014 through our Office of Practice Management. The Office of Practice Management frequently communicates with payers regarding changes to clinical and coverage policies, which requires a coordinated effort to review relevant policies and, when warranted, sending letters directly to payers on behalf of the concerns of Academy members and our patients. Dr. Richard Hunsinger leads this effort and is assisted by Dr. Wiley Song. So far, in 2020, nearly 2,700 policies related to our specialty have been reviewed. And after reviewing these policies, over 300 letters on topics ranging from measurement of exhaled nitric oxide, biologics, and sublingual immunotherapy agents have been sent to various payers. While we don't always receive an official response, subsequent revisions in the relevant policy often reflect revisions based upon the concerns that we identified and communicated in our efforts. As you've heard during this video chat, there are countless hours of advocacy work being done on behalf of you and your patients. We sincerely appreciate the dedication and commitment of all our volunteer leaders whose engagement enables the Academy to provide unparalleled information and advocacy efforts. But as you know, our advocacy efforts are always best when inclusive of member engagement, so we welcome your outreach to us. Please email us at any time at advocacy@AAAAI.org.